Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello, everyone. You're welcome to Early Intervention Matters podcast. And I hope you've all had a good week. We're going to make a little bit of a detour in our discussions today, but we will see how this all links up later. And I'm really happy I've got Dr. Simoyan, who is a long-standing friend. We've known each other from, should I say, babyhood till now. Dr. Simoyan is an addiction medicine physician. And I'm going to do a bit more introduction after she says a quick hello. But I'm really thrilled to have her here because, she's a woman of many parts. And I keep getting very fascinated by all her achievements and all she does. But I just felt that it was important for Dr. Simoyan to be on this platform to help us as parents when we are supporting our children in their different careers, to take some nuggets from this talk today about how we do this work. But I'll let Dr. Simoyan say a quick hello before I summarize her bio.
Hi. Thank you so much for having me, Dr. Takon. It's my pleasure to be here today. And I'm just excited to talk about, creativity and all the other fun stuff that we'll be talking about. So thank you for having me.
Thank you, Dr. Simoyan. So Dr. Simoyan, she's an addiction medicine physician, and she holds an appointment as a full professor in the Department of Psychiatry at Drexel University College of Medicine in the United States of America. Dr. Simoyan earned her medical degree from Penn State at the University College of Medicine, and she received the Leonardo Humanism in Medicine Award at graduation. I told you she's an excellent lady with lots of awards. She completed an internship in psychiatry, took family medicine at the University of Pittsburgh Medical Center, and her family medicine residency at the Penn State Good Samaritan Hospital Family and Community Medicine Residency Program. So she graduated with the Family Medicine Resident Award for Scholarship. So prior to her medical training, this is where it gets really interesting. Dr. Simoyan received a dental degree from the University of Ibadan College of Medicine in Nigeria. So Dr. Simoyan and I graduated from the University of Ibadan College of Medicine. She read dentistry, I read medicine then, but we both graduated at the same time. But Dr. Simoyan went back to read medicine, as I read earlier. So you can see how hardworking and motivated this lady is. She then had a Master of Public Health degree from the Johns Hopkins University, Bloomberg School of Public Health. She's board certified in family medicine and addiction medicine, and she's contributed to international public health education as a Fulbright specialist in Nigeria. And she's also been an Erasmus Mundus Scholar in France and the UK. Dr. Simoyan has other parts to her. She's volunteered on medical mission projects in Nigeria and Haiti. As we said earlier, she holds a full professor in the Department of Psychiatry. She's published in several peer-reviewed publications. She's served on editorial boards of medical education. So she's really top of the game in her career. She's been founding editor-in-chief of Black Diamonds and Silver Linings literary journals. So one thing that you need to know about Dr. Simoyan is that she's not just interested in just the medical line. She's veered into so many parts. The time will not allow me. I tell you, we can dedicate this whole program to reading Dr. Shimoyo's bio. But just to sum a bit of it, she's veered into other parts. She's a member of the American Medical Women Association's Music and Medicine Committee. You heard me right, Music and Medicine Committee. She has curated a photographic exhibit featuring prominent women in medicine. And when I tell you that Dr. Shimoyo is a keen photographer, that is a huge, huge part of her life. And you would see how we'll bring this in. As someone committed to bridging the gap between the medicines and the arts, she's served on both research and medical humanities, graduate medical education subcommittees. This lady has received tons of awards. I can't even name them. It fills the page. But one of the things she's done is she's got an interest in writing. Dr. Shimoyo has published several books. Some of them are on Amazon. If you go there, you'd see. But she doesn't just publish about medicine. That's the interesting thing. She's written lots of books that spans a whole wide range of interests. She published a workbook for patients in recovery, transformation and recovery, lessons from the butterfly. And this is the beautiful thing. She links nature to her career. Her forthcoming book, Girls Become Doctors and Much More, showcases some of her career highlights. In that book, it features over 60 women physicians from all around the world. Dr. Shimoyan believes in the need to transform education and healthcare with a focus on creativity, and that's why we brought her here today. Problem solving and integration of the arts and sciences. So, Dr. Shimoyan, we are so privileged to have you on this platform because, we can't capture everything that you have done. But for people listening into this podcast, this just gives you just a snapshot of Dr. Shimoyan's work. And you can go to www.thedoctorwriter.com. Again, I repeat, www.thedoctorwriter.com to learn more about Dr. Shimoya's work. I tell you, you will all be blown away by all the things she's done. So thank you, Dr. Shimoya. Today we're going to be talking about linking creativity and neurodiversity. But before we go on, I just felt that it would be good to talk about why we are talking about what we're doing today. Growing up back in Africa, in Nigeria, where we will all remember our parents were very driven for the best for us, but it was the norm then that the only way that you could succeed in life was to follow the traditional education routes. So the typical Nigerian parents would want their children to have a list of careers. Topmost would be medicine, engineering, pharmacy, and then others. So it was not unusual to find that most parents were going down that traditional route. So creativity was not a word that we grew up with. And if you had a creative side or you brought out the fact that you were going to do anything in the, arts and all that, they looked at you as if, there was something wrong with you. And it was frowned upon by your immediate family and those around. But it's important to know that we're living in a changing world and that many people who went down that traditional route, it's not everybody that's been fulfilled by the journeys that they were set on. And this has been looked at over the world. And because of lots of things that are going on in the world, we feel that there is a need to re-educate families and, to help families understand the importance of nurturing creativity, both for neurotypical children and neurodivergent children. Now, if you look at where the world now, in the World Economic Forum published a document in 2020, and they highlighted that because of the change in technology and lots of things going on, a lot of the traditional careers are going to be replaced by robotics and are going to be replaced by technology. And a lot of people are going to be out of a job. So people who have been focused on just the traditional routes of, you know, doing work, and if they don't have any other skills, may find themselves out of a job. And therefore, it is so important that we nurture our children um, and diversify their interests from the onset, and that the choice of what a child does is not focused on what the parents think. We'll talk a bit about why it's important to nurture creativity in neurodivergent children, because a lot of the children who are neurodivergent have had this strength of being creative and they've never really been supported because parents have felt they're not succeeding in traditional school. So why should they be encouraging that? So the focus for most families is no, you need to do this. And any bit of creativity is quashed. So we'll talk about that as time goes on. But we're going to start first. We're going to start first by discussing some things with Dr. Shimoyan. Now, because Dr. Shimoyan has been a long-term friend, I will be referring to her as Peju in this talk. So, Peju, please, can you tell us when you noted that you had this creativity instinct or trait in you? At what point from your childhood days did you notice this?
First of all, thank you for the gracious introduction. That was really very generous of you. But yeah, creativity, oh my goodness, that's a tough question because I honestly didn't think of myself as creative as a kid. I didn't think of myself as creative or as an artist. To me, an artist was somebody who could draw, and I couldn't draw. I still can't draw. It really took me a long time. But I know that, even as a kid, I liked music and I knew I liked writing. I wanted to write, but like you said, the environment we grew up in wasn't really conducive to nurturing those interests. And I remember when I told an older relative that I wanted to become, she asked me what I wanted to be when I grew up. I said I wanted to be a pianist because I liked music. I liked piano specifically. And she just gave me this look and was like, you better think about a real job. In Nigeria, that's a hobby, so you better think about a real career. And when I was a bit older and told my parents that I liked writing, there were a very similar response. That's something you can do in your spare time. Of course, they want you to be a doctor. So, and then they generally push you in that direction if you're good at the sciences. Like you said, you're generally encouraged to be a doctor or a pharmacist or an engineer. If you're more arts inclined, lawyer. Yeah. So for me, I have to say though that even at a very young age, though, it was like I was constantly writing in my head. We didn't have the internet then, we didn't have computers, but it was like I was constantly writing this story or this book in my head. And I remember as a child, I was like 10, imagining that I would write a book. And at the back of the book where it has the about the author information, I imagined that they would write that the author was only 10. Years later, I remember I was like 28 and I was like, oh my goodness, I'm almost 30 and I still haven't written my first book. So so those interests were there from a very young age, and I think the fortunate thing for me was that I never lost the interest. I had piano lessons very, very briefly and then changed schools and didn't even have access to a piano during the school year. So I would only practice when I was home on holidays. But I never lost the interest, so I would just, play when I could, like, play the piano when I could, and as I grew older and, let's see, this is as I grew older and continued my career, the interest in music was always there, and rather than disappearing, it actually got strengthened. When I finished my MPH at Johns Hopkins, my Master of Public Health degree at Johns Hopkins, I had a few months before I started working, and I was staying with friends in a house. There was a guitar that nobody played. So at some point I picked it up and then I somehow I don't even remember exactly how it happened, but I somehow learned how to play a few chords and realized that all you really have to do on the guitar is to play a few chords. You don't have to play anything fancy, and you can accompany, people who are singing or accompany yourself. So I basically taught myself how to play the guitar. And when I realized that, oh my goodness, you can play simple chords on the guitar, I realized you can do this on the piano too. I don't always have to struggle to read. So one thing led to the other, to the other. At some point, I had always wanted to play the flute as a kid. And when I was able to buy a flute for myself, I did. So I took a few lessons and then figured I could just do it on my own. So one by one over the years, I just picked up different instruments, knowing that I was never going to be a virtuoso on any of them. And then when I was in my first faculty position, I picked up the ukulele, and since I had taught myself the guitar, picking up the ukulele was relatively easy. And I joined a ukulele group, and we would perform at events at times, or go to nursing homes at times and sing and perform. And then the struggle I had was, how do I incorporate all of this into my work as an academic physician? And that was a bit of a challenge. Sometimes we would have like talent shows for the medical school, and I would join the students, support them, maybe even sing along with them and that sort of thing. But it was really hard to incorporate it into my work. It shouldn't have been that hard, but I just had challenges in that area. And then eventually, at some point, when I was working at an inpatient rehab facility, I was doing group sessions with the teenagers and the young adults, and I would talk to them about the developing brain and how their prefrontal cortex was still developing, and that's why we can't always count on them to make good decisions and all that. So after talking about drugs and the brain and everything, at some point I decided to start incorporating music. So I would bring my ukulele, and then we would sing at the end, and I would play. Or sometimes maybe one of them was musical and they might play the guitar or the ukulele and sing along. And I keep thinking back to this one incident where this patient who was there for treatment, a teenager who had brought her ukulele with her to treatment, and she had composed a song. So she shared this song with us, and it was so moving and so touching. Yeah. And so I've just been able to, you know, find creative ways of, bringing my interests together. And then I also, at some point, I found out that the American Medical Women's Association has a music and medicine committee. And I hadn't been a member of that organization, of the American Medical Women's Association, since medical school. And then now that I found out that they had a music and medicine committee, that was for me enough of a reason to renew my membership. And then I got really involved with them, and I began to see that, well, there's so many other physicians who are actively involved in the arts, and some who are even like incorporating music into their work. Like the chair of our committee, she works at the VA, and she works with veterans. She's a psychiatrist. She works with veterans, so she has music sessions with her patients, and she writes poetry as well and writes songs, and I've met so many amazing women through that group. And then last year, a group of us went to Germany for the International Association of Music and Medicines conference in Berlin last September. And that was a great experience too. There were people, not just medical people from different professions who were, presenting their research, presenting their work. And it was just an amazing, awesome experience. So that's, a little bit about the music part. We can also talk about the writing as well.
That's just fantastic. I think that's just wonderful. And thank you for showing us how you incorporated that into your career, because I was going to ask you that. And you can see that there are young people out there with so much talent. I'm just thinking that if you hadn't found a way of introducing that, because obviously you're the clinician and they're the patients, there would be this barrier between yourself and them. But because music was something that you used as a bridge to reach them, and by doing that, you were able to discover that there were lots of young people there with talents. And it just makes me again go into the role of creativity. We've got this epidemic now of mental health issues in young people, anxiety, depression, and many of them would have stemmed from so many things, frustrations and,
Mhm.
you know, being unfulfilled, being anxious, things not just working out. It just makes me feel that how can we incorporate, again, bringing this to early intervention matters, how can we incorporate that creativity right on from the start? Because these are young people with talents in an inpatient unit, and many of them possibly, if they have been shown an avenue to actually, nurture those talents they had, would probably not have ended up where they are or made the choices they did. So can you tell us whether you noted in your career in mental health, in psychiatry, in your field of addiction, whether some of the young people that you've seen in this unit, the levels of creativity that have been untapped in these young people, and it has helped with their treatment and
Well, I would like to believe that allowing them to express themselves creatively did impact their treatment. Of course, I don't have any like actual data that I can point to, but for example, I got, you know, positive feedback from the patients that they would say things like, "Wow, this was the best the best group I've attended since I've been here," you know. And was it the music or was it the talk? I don't know. Was it a little bit of both? Maybe, you know. But I think that it really is important to allow children and youth to allow them to express their creativity. But how can they do that if they're not exposed? You know, some of them may not even realize that they're creative. So we need to create an environment, whether it's in the treatment centers or in their homes or in their schools. I think we really need to create an environment where they're exposed to different opportunities and different ways of expressing themselves creatively, you know. So rather than assuming that everybody has to play a certain instrument or everybody has to sing or every, you know, allow them to try different things out, you know, and to do, you know, to stick with what, you know, what resonates with them. And the other thing about music in particular is that one, it has benefits in terms of healthcare, in terms of, you know, of helping patients with pain. I mean, there's so many benefits there in terms of memory. That's a whole other subject. But it also helps with learning. And I think there's a lot of potential that I believe is yet to be tapped in that area. Like if I can give a specific example, you might have a child who is struggling to understand like fractions in class, in math class. And that child might not understand fractions when they're explained, when the concept is explained mathematically, the way the math teacher would. But music is very mathematical. It's very mathematical. Rhythm is a big part of music, you know. You know, are you playing in 3/4 time or 4/4 time? And that's basically fractions. So a kid who is naturally musically inclined and who understands musical rhythm and it comes naturally to that kid, maybe that could be if that kid is struggling to understand fractions in math class, maybe you could use musical examples to explain, you know, 1/4 plus 3/4. You know what I mean? We really have to meet kids where they are, but how can we do that if we don't understand, if we don't understand how they learn best? And uh, it really means we'll have to individualize the way we interact with these kids and the way we teach them, you know, and that's a challenge. But I think that, you know, it's something that really needs to be explored. And I think that there's really a lot of potential for transforming the way we educate children. If we could only if we could only appreciate, you know, the importance and the potential impact that music and musical training can have on these kids. So besides the mathematical aspects of the language, a lot of musical terms are, you know, Italian. Yeah. So is it Italian now? But so you're learning different languages when you're learning music, well, when you're learning music formally, you know. And then, you know, the movements, think about if you're playing the piano, if a child is playing the piano, think about all the different things that are going on. So you're reading music, you're using your vision, right? You're using your fingers to play the keys, you're using your feet to press the pedals, you know, you're using your hearing. All of that, and if all of that is going on a regular basis from a very, very young age, think about the potential impact on learning, developing those skills, those hand-eye coordination, and then coordinating with your feet as well, and all of that. And imagine the impacts on your nervous system. And yeah, so I think that there's a lot of potential that we really have to still tap into.
You're absolutely right. And I think this happened to me yesterday, actually, in the clinic. So I had a little child who came in, and the one of the things was that the child had speech and language delay, and but he was very fascinated by numbers, and all he kept on doing was coming to my keyboard to look at the numbers, and he was fascinated, and I observed him trying to count with his fingers, and all of a sudden, I was writing. I had this humming of a song to a tune. And I looked and I asked the parents, I said, who's singing? And it was him. He was, very tuned, singing a song. You could identify the song from how he was humming. And it was just fascinating that, he had this skill, even though couldn't really speak. And that was the second child she had problems with her speech, wasn't clear. But what was fascinating was she makes up songs. So she can, if you say something to her, maybe like a flower or something, she would then make it up into a song. She would then use that word and create a song out of it. And it would be a really good song. And I was so fascinated. And I thought, wow, there is a part of the brain that is really, really, that we haven't tapped into, that the children have lots of skills in. And that when, like you say, if we're using the traditional way, like to look at every child's learning, then we're going to fail a number of these children, because here are skills that are untapped, and but they're actually really skilled and very good at that. So yes, you really tapped in that. This, again, as we mentioned on this platform, it's about parents identifying, knowing their child, giving them the space to explore, because
Exactly.
it's only through exploring you would know what is that child's interest and what are they really doing that's really good, and that you can nurture and give them the opportunities. So I completely agree with you. And it's just, I think what I find fascinating about your journey is the fact that that dream never left you, that you still had that dream and you were still looking at how to explore it and finding yourself in spaces where you could develop those skills and actually enhance it, has led to the success of all the things that you've been doing in your work. If we just talk a bit about your writing, Paige, do you want to just shed some light on the kind of things that you write? Because I learned a lot from you yesterday just by talking about some of the things that you were writing.
So like I said, I always wanted to write at least since I was 10. And I didn't write my first book till just about less than 10 years ago, just under 10 years ago. But for me, it's like I knew I wanted to write, yet I was so busy with work and my academic career and all of that. So at some point, I had developed an interest in photography. And I wanted to share my photography. And I thought, I don't have the time to write a textbook. I don't have the time to write an autobiography. But what if I put some of my photography into a book? Like a photo book, a picture book, and then that way I would still write something, but, I wouldn't have to worry about having to have a whole chunk of time. And so that's when I was living in Scranton, Pennsylvania, I self-published my first book, which was basically pictures I had taken in and around Scranton, and, and then little bits and pieces of history. So it was, yeah, that was my first book. 16 was when it was first published. It didn't go on Amazon or anything, but at least I did it. Yeah, I I published it. And then after that, I had all these nature pictures and I really wanted to share them. And I had a lot of butterfly pictures. So I just put together a little butterfly book, just different species pictures that I had taken, and little bits and pieces of information about the different species of butterflies, and a little bit about the monarchs and how they migrate to Mexico for the winter, and then information about other species. And that was the following year. A couple years later, there was the pandemic and I moved and all of that got busy. And then there's another book I've been working on, which was a devotional based on readings from the book of Proverbs. And And I thought for that, I've been working on it on and off for a while. And then finally in 2022, I just decided I worked with the coach who's also a physician, but she coaches people in terms of, helping people to get books published and other things too. So at that point, wanted to finish the devotional book and also put it on Amazon. And that's something I hadn't done before. So I worked with her to just get that book done and figured out the process. She walked me through the process of publishing on Amazon and all of that. And she encouraged me to redo the butterfly book, to have it professionally laid out and all of that. And we did that. I did that with the layouts, with the professional graphic designer. So the new version ended up being a lot nicer than the original one. And then after that, I was just on a roll. I now put out another edition of my Scranton book. And Scranton, I don't know if you know, but former President Biden is from Scranton. So when I had written the first book, he was vice president, right? He was vice president then, but by the time I was putting out the second edition, he was president. Streets had been named after him. The medical school had changed its name because it had become part of Geisinger, the health system, and was no longer independent. So there were a number of things that needed to be updated anyway. So I did that, and then I was just on a roll after that. It was just one thing after the other. Then I published in what order did they happen? A workbook for patients in recovery from addictions or other behavioral disorders, comparing the stages of change in behavioral health, pre-contemplation, contemplation, action, preparation, and action. Anyway, I comparing those to the stages of the butterfly's life cycle. And it's a workbook that patients can go through their cases, their questions for reflections. And then I've been wanting to write a book about animals and include pictures I had taken of different animals. But as I was trying to prepare for that, I learned so much about giraffes and I was so fascinated by them, and I decided that they needed their own book. So that's how Giraffes Are Amazing was born, and they're just very, very fascinating. When we think of pollinators, for example, we think about birds and bees and butterflies, but giraffes are also pollinators because they're so tall, they can reach trees that other animals can't reach, and they help to pollinate them. And I learned so many other things about their circulatory systems, why they don't have their blood pressure is really high at the heart level, and it has to be because their necks are so long so to be able to pump blood all the way up to the brain. But then why don't they end up having strokes? Well, they have so many adaptations in their circulatory system. Anyway, so I write about that in the book. Even the spacesuits that people wear when they go to space, the astronauts wear. The design was informed by research that had been done on the giraffes, right? In terms of how their bodies how their circulatory systems adapt. And anyway, it's just there's so much. I don't want to go into too much detail, but it was studying the giraffe's circulation that gave scientists insight into um, how to um, how to develop suits, the space suits that they wear that would prevent the astronauts from having the problems that they have with their circulatory systems when they return to Earth. When they return from being in a zero gravity environment to Earth. Yeah. So there's just so many things that I learned, and I kept learning more and more about animals, and I still have a long list of books that I want to write about animals and my photography. Yes, yes, but then there's so many connections between human health and animal health and environmental health and all of that. So I think that there's just so much we could talk about. But I find it very fascinating, and I love to take pictures of these animals. Remember when we were in Durban, South Africa for a conference, and you refused to go on a safari with me because you didn't want to get eaten by a lion. And I was like, I can't come. I was like, I can't come to South Africa and not go on a safari.
Yeah, it just
Without you, I deserve that. And I got my pictures.
you has had this long-standing fascination. I mean, you can't go anywhere. And we do sports on animal, and she's drawn to it like a magnet. Yeah. So thank you so much, Pedro. And as you've all learned this evening, that's there's always so much to learn from the interest that she's had in other things, and she's been able to incorporate it. And I think one of the things we've talked about, which you brought in earlier, was how we can use those creativity in young people, in with our neurodivergent children, where people in the traditional school will say they can't do this, they're not writing, they're not doing this, they're not doing that, without actually looking and saying, can that, the approach should be, what can that child do, not what can't they do. And I think the ethos so far has been, oh, they can't do this, they can't do this. Whereas there's a lot more that that child can do that we can actually um, incorporate into that child's learning. And you then have happier children, because I just believe with a lot of the difficulties which young children encounter at school, which results in a lot of anxiety and frustration and meltdowns and them not wanting to be there, it's because they are in a situation where they're placed in an environment which doesn't just suit them, but they're not being exposed to things that they would actually be comfortable and like doing. So, as parents, it's very important as early as we can to actually discover what are those things that the children like doing and expose them to it. And again, this brings me back to even talking about parents when we're guiding children into what they should do, because this still happens in Africa, still happens in my country, Nigeria, where, everyone just feels, I just want them to meet that course because that's the course that's going to get them there. So even when the children show other interest, no, that doesn't suit you. Why don't you think about this? And I've seen where there have been lots of unhappy young people. Young people have spent years going on the wrong area because their family wanted them to do that. I remember as a doctor in Nigeria, I had a house officer once whose parent was a professor. And this young person, it was so obvious they never really wanted to do medicine, but
Yeah.
they had been forced down that way. And
That.
he had decided that, okay, I will do it for my parents. And did that. And this young person, it quickly came to light during the house officer days that he had no interest in that and he couldn't just wait to just leave. And that young person, made sure in many ways that they kept on showing that they were not interested in doing that. But I felt quite sad because I felt 7 years of your life
Yeah.
you have spent it doing this because it's what your parents wanted you to do. And you've gotten to the point where you no longer have the interest in doing it. So you've decided to go a different way. And this is why, and for some of them, they can make that choice and they can find another way out. But there's some young people who, through that process, become very unhappy
Yes.
and, go the wrong way, make the wrong choices and go a different way. So I just want to use this opportunity that when we're talking about early intervention matters, it also matters to safeguard our children's mental health and fulfillment for later life. And it starts very early. Starts very early. That's why play is such a beautiful thing.
Yes.
Because just like you talked about the brain and the different areas of learning, play is an area that helps children develop lots and lots of skills. There's a creative, there's a problem solving. They become more balanced individuals as they grow up. And so right from when they're younger, we shouldn't just be bystanders as parents. We're just waiting for that time to say, okay, this is what you're going to do. But we should take an active part in knowing what the children are
Exactly.
interested in and give them the opportunities to explore what, the things that they want to do. And I relate that because I know you've been to Nigeria, you've done a few things in Nigeria since being in America. What would you say is the difference in approach, if there's any, from when you were there to when you've gone back? Are we still seeing the same ethos about even in med school or when people are studying, people go just one way and study just one thing without actually opportunity to diversify. So even if you want to be a doctor or any of the other professions, there are so many other interests that you can have along the way, apart from just doing one thing. So do you think that has changed?
I would like to hope so. I'm not 100% certain that it's changed significantly. But I'd like to think that people are beginning to be a little bit more broad-minded, open-minded. And when I did my Fulbright trip, this was like a decade ago now. But one of the things that Dr. Oshodi and I did, we had a like a leadership training program for medical and dental students, and one of the things that we did was a creativity workshop, and that was our goal, to just get people to think outside the box. Okay, you're going to be doctors and dentists, but but you don't have to be stuck in a box. You can do other things. During that session, we allowed them to just be creative, to express themselves creatively, and they came up with the most amazing and impressive pieces of art and things that you could think of. And then they had, not only that, they were given a chance to talk about whatever it was they created meant to them. So the person who won the creativity award, or whatever we called it, was somebody who had come up with, she had these strings of figures, like human figures, cut out from different colors, different colored paper, and basically they were all tied together, and it was like the message was, there's strength in diversity, you know and then somebody else had a map of Africa, and he had highlighted Nigeria, and how Nigeria was the beacon of hope to the rest of Africa, or something along those lines. It was amazing, and then there were some musically inclined people there. So I remember one student was playing the violin and, providing music. Well, it was really amazing to be able to see these clinical students express themselves so creatively. And I really hope that they were able to take that with them into their careers. It's a sort of thing that we would have loved to have continued, but obviously you need funding. You need funding to do that
Yes.
sort of thing. Yeah. So hopefully, in at least talking about these things, we're at least hopefully raising awareness. And along that line, when I was talking about my books, I have a forthcoming book which is titled Girls Become Doctors and Much More. And that's one of the things that I try and highlight in the book, that even if you do become a doctor, which is a wonderful thing, that you don't have to be stuck. There are many ways of being a doctor. You can be a doctor and still bring your music or your writing or your artwork into your clinical work, or at least some people just keep it separate, but they continue to make music or to make art, even though it's separate from their clinical work. So whatever works. But I just feel that we're better doctors or better clinicians when we bring our whole selves to what we do, and when we express ourselves fully.
That that no, that's really good, and I'm really pleased that we're doing this session because this is kind of laying the ground for. I have some young people who I'm going to bring on future episodes who are neurodivergent, will have amazing skills, and again, it's to showcase that there is no limit to
Yes.
what people can do. And one of the things I want to highlight for our parents of children with neurodiversity is that neurodivergent children are actually quite, they bring a lot to the table. They possess very unique perspectives and strength. They have a lot of them have very innovative skills because they think outside the box. They think in an unconventional way. And that's why sometimes you see some amazing things that somebody has produced and you think, oh my God, how did they do that? It's just because they have that ability to, be so creative with that part of the brain. And if we don't tap into that, if we don't allow them to express that, we're never going to see that beautiful gift come to life.
Exactly.
They're open-minded, so they've not come in with any restrictions in the way they think. So they challenge conventions and they just allow their minds to flow and they just do what's on their mind. But all this creativity, and I think when I was just looking into it, I found that actually when you have a creative brain, there's a lot that you're coming out with it helps you with, problem solving because you are actually thinking about other ways to do things. So, which I imagine, pages, when you're doing some of your work, you're looking at what ways and other ways to put it. You're not just following a rigid script, which unfortunately, when we do things like medicine and things, you have to follow the exact way in which things are. Your creativity allows you to just explore. I mean, it could be that you've done that painting that way and it brings out something extraordinary. It seems out resilience, you know. When you're creative, you find that, resilience is something that comes out of it. You want to do more, but because the more you see, I think what's been you said something here. You said, you've been unstoppable since yes, you did not start until about 10 years back, but yes, you truly have been unstoppable. I remember you coming over from America down last year and literally visiting places, so many places in Europe. And you also, for the audience, you launched a Christmas CD and a book last Christmas, which was an amazing. But you actually went to Austria to visit, those places, the exchange, the silent chapel. It opened the world for her, and she's going to tell us some of the benefits of her creativity. But it's about linking the world and expanding your world, and that's what nurturing some of those things does to our young people. So when we put children into a box, we are actually limiting all these skills from developing. So even the neurodivergent child that we feel, oh, they're not doing okay in the traditional learning world, put them in an area where they can flourish, and you will be amazed about what they can produce. Again, from what I said before, employers, we are in a world where a lot of these rigid jobs are going to be, not existing anymore because technology, all these things have come in and people are going to lose their jobs. We can already see some of the things that happens. You go to the checkout counter, which used to have human beings before. Most of the shops have been replaced by automated checkouts. You can't talk to physical persons. You go online, you can't talk. You're constantly being confronted by technology taking over a lot of the jobs. But the skills that people have, the creative skills that people have, is always something that belongs to them. That it's something inherent that they continue to expand and expand upon. And I just want to use this platform to help parents rethink their young person's learning, rethink how they support the young people in making choices, how people are not rigid in the way they're looking at things. And I'm happy in many ways things are changing for some people. I'm seeing a lot more young people coming out with different careers and doing amazing things. I keep getting amazed by a lot of things other young people are doing. We need to nurture this more. I just, Peju, could you just tell us a bit about how the benefits for you? I know you've talked about some of them.
For creativity.
Yeah.
Well, one thing I'd like to say is that, like I alluded to this earlier, that is, I think we're better clinicians. Even as clinicians, we're better at what we do clinically when we are fully engaged with all our other abilities. So if there's an artist in you, if there's a musician in you, developing those developing those interests and those abilities can translate to the clinical setting. Let's just give you a few examples. Somebody who has a well-trained eye because they're an artist and they've learned how to critically examine artwork, and to appreciate minor differences in color and texture and all of that. That could be translated into examining x-rays and MRIs and picking up subtle changes, or when you're examining a patient's skin and you might pick up a subtle rash or a subtle color change, that things like that you might not necessarily have been able to pick up if you hadn't developed those skills. Listening skills for a musician. Think about now listening for a heart murmur, and those murmurs that only cardiologists can hear because they're so subtle. But a musician with a well-trained ear might be better able to pick that up, right? So those are some very, very specific examples. But just in general, I think that creativity is so important because, like you said, a lot of the workforce is changing so much. But one thing I like to emphasize is the fact that youth, people need to be able to think outside of the box. And it's allowing them to express themselves creatively. That is what is needed in the workplace for problem
Yes.
solving.
Yeah.
Not memorizing all the answers so that you can get 100 on the test, on the multiple choice question and everything. No, it's people who know how to think outside the box and how to see things from different perspectives that will have the skills that are needed in the real world to solve problems. And that in itself is a huge reason to encourage creativity.
You're very right. One of the things I tell young people is that you have to show how you're different from everybody else.
Exactly.
If you put in a CV that just says, oh, I went to this, I read this degree and all that, and there's nothing different about you, there's nothing else that you bring, to the table, then it's just going to be the same uniform
Exactly.
workforce. But if you're somebody that has, like you said, thinks outside the box, and that gets nurtured from the beginning, it gets
Exactly.
nurtured from the beginning. So it is so important, like we've said, it's all areas that this develops, the creative side. And thank you so much for explaining all those things in detail,
You're
the
welcome.
eyes, the movements, even things like playing the piano. You can imagine how many developmental skills are already being enhanced actually by being able to, when you play the piano, you are using two hands and you're moving about. There's things that are going on, and it's also calming. It's
Mhm.
also calming for people with anxiety or mood problems. It's calming. So there's so many things that are being developed: physical, emotional, cognitive, social. So even a child that you say, oh, doesn't have good social skills, but there's something going on with that music that is making this
Mhm.
connect. So I just feel that as families, we should see the advantage
Yes.
of not just putting children in a box and saying, because this is one of the things that's usually frustrating when children are in schools, they're made to feel non-achieving, like they're a failure just because they haven't succeeded in the in quote traditional route. But that same child, and we see it happening all the time, that same child in the right environment with the right space will become phenomenal in the space that they are
Exactly.
allowed to excel. So thank you so much, Pedro. Just before we go,
Oh.
what advice would you give to parents listening in? Thank you so much for sharing your journey, um, and sharing the early parts where you were told, "Oh no, that's a hobby." And I'm so happy that you're enjoying your hobby now. Those things that were pushed aside are the things that you're enjoying now and feeling very fulfilled about. And also the fact that that dream did not die. You said you kept on. One of the things you said here was, I saw myself as that 10-year-old published author. It didn't happen at 10, it didn't happen at 28, but it's happened, and it's happened in a big way. So it's about people not giving up on their dreams,
Yes.
which you haven't done. I mean, it's like you're just doing more and more of it, which is just phenomenal each time. I remember visiting you and just saying to you, and you and I have had discussions and saying, gosh, there's so much more, that you're
Yes.
going to do, because I could just feel the passion of what your creative side
Mhm.
when I visited you. So you sharing that fact that you had that in you, but you were able to still use it because that dream didn't die, and you were able to explore opportunities, and you were not restricted by the fact that you had done all this academic work and all that. You still incorporated it. And I just feel that there's a lot to learn. We've also learned as well the benefits of the creative mind and all it does in terms of the child's development and how the children can learn by those areas of their interest, be it music, be it, whatever they choose. And also that there are parts that are being developed. So if that child is being creative, there are exceptional things that are being developed in that child, even though we can't see it, but things are happening and that we should tap into this. That, again, a reminder that, there's so many positives to the creative aspects of our lives and how the impact on, socially, the impact on mental health, the self-esteem, there's so much, and also giving you the additional skills that you need in a changing world and a changing workforce. And that is real. We're in a changing world, and we have to really take on board that, things are changing. The AI world is developing even faster and faster. And so just exposing our children to things that, they would be fulfilled and happy about
Yes.
would be important. And also our neurodivergent children, many of them have exceptional interests and skills, and being able to nurture that. And as parents, if you have a neurodivergent child, not feeling that because that child hasn't succeeded in the traditional way in which the world sees learning, we shouldn't consider that a failure. It should be something that makes us want to go out more to actually, when you discover that child's got a skill, look at other ways in which you can support that child. So thank you so much, Peju. Thank you so much. And everyone should keep watching the space, and please visit Peju's page with the doctorwriter.com.
Yeah.
She has a lot on that, and you can follow her on that page and look out for her future work because they're all fascinating, I tell you. And just look out for more of her work. So thank you so much for sharing your time with us, and we look forward to hearing more about your future books and activities. Thank you.
Thank you for having me, Inyang. My pleasure. Thank you so much.
As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.